Well, we have seen it all over the news lately, folks. The Ebola outbreak in West Africa is the largest ever recorded.
But today, researchers and health workers have a few technological resources they didn't have before. So joining us now to talk about the Ebola technology is our tech expert, Nika Allen.
Nika, thanks for coming in. Really important discussion here because there are so many questions out there in terms of stopping the spread. How are we treating it? How are we keeping it from coming to our shores? It's obviously already here in the United States. So what technologies are being employed by healthcare workers and governments also to stop the spread?
That's a great question. We're actually seeing very common technological resources that we really take for granted in the United States, well used in Africa to help stop the spread. Three of those technologies are text and messenger, GPS and mobile mapping, and social media and search engines. So very common things, but they're really using these in the most effective ways to stop the spread.
Okay.
So things as simple as text messaging, I mean, these are making a difference?
Yeah, text, not so innovative, right?
Yeah.
But they are really making a difference with them. They are using more households in Africa actually have access to cell phones than they do landlines. So texting is really widely available.
Okay.
So they can share information about the warnings, danger, and
Without
how
coming
to,
in direct contact.
Exactly, but they can connect with people in the most remote places in Africa and how to avoid catching it. Actually, the British Broadcasting Corporation, in partnership with a company called WhatsApp, which you guys probably know, now owned by Facebook, has started their own Ebola health messenger line.
Really?
Which they provide breaking news alerts and public health information to African people.
So you can stay updated.
Yeah, so people can stay updated on what's going on, which is very important, you know, to just be hyper vigilant about where things are coming and what's happening.
Yeah, absolutely. Now, you also said something that I think is interesting, GPS and mobile mapping. So how is that helping in the fight?
GPS and mobile mapping, as you guys probably know, it's easy to track your cell phone. There's radio towers, satellites. It can pick up your location coordinates very easily. So what they're doing now is actually mobile carriers in Africa have actually given over this information to public health workers and people who are spotting trends, and they can help track the disease and predict where it might be and come up next.
Wow.
So actually, if someone comes into the hospital, for example, and they have Ebola, if they have a cell phone, they can take their cell phone and look at the data and see where they've been and potentially predict.
So they can backtrack.
They can backtrack. They can predict who they may have come in contact with, what parts of the country they've been in. So they can really look at that to help make
because
good predictions.
that's a big thing that they're trying to figure out is through that. Their contacts and what they did. I know that there's a window of time that when they're asymptomatic, they're apparently not contagious. But how long are they asymptomatic? Is it a couple of days? I mean, just recently in New York, the doctor that was tested positive, he was out bowling. He was out, riding the subway. So backtracking that, they can figure out where they have been. That's a great idea. I never would have thought of that.
Yeah, and so it's a little sketchy because when are we able to track someone's location or things like that? Those kinds of questions come up. But if you think about it in a situation like this, if you're saving lives, I think that most people can say that this is a great use for that.
And then social media and search engines.
Yep, social media and search engines, something that we talk about here all the time. They are great sources of big data. They collect tons of information. And so by monitoring and analyzing some of the search terms and status updates that people are using, companies are actually able to spot disease trends again. So maybe someone says hemorrhagic fever or whatever, some terms that might be relevant, and they can say, oh, there's a lot that's been going on over here, so we can predict that this may be an issue in that area.
Gotcha. Okay, so they're looking in the past, they're looking where they've been and where they could potentially be going.
Yep, exactly. And search engines, of course, are great places for people to self-educate, for them to figure out how to prevent from getting it themselves and how to prevent spreading it. And then also social media campaigns, just like the ALS Ice Bucket Challenge that you guys probably saw, helped raise money and awareness. And so there's one, I'll show you guys a video now. It's called Shake Ebola Off, and it is from EbolaNow.com and Emergency USA. Emergency USA is a organization that provides free health care to developing countries, and they're helping raise money for medical supplies.
Gotcha.
So we're really seeing, a lot of different technologies that we really take for granted, and they are proving to be very efficient and helpful.
Fantastic.
I think it's amazing that we can help from here, you know, with our technologies without even having to.
Absolutely. Well, of course, technology going to be a big help in this fight. And for more information on all of this, if you're curious about it, head over to casa.com, click on the Style tab. Again,